warm welcome to everyone tonight. My name's Alex Harkins and welcome to our evening webinar, and I'm chairing it this evening. Our webinar tonight is on the UKDHC Real Deal Programme, Remote Evaluation and Lessons, Digital Expertise Assisted Learning. Just to give you a little bit of background in case you haven't read the sort of information about the talk, the UKDHC, in collaboration with the University of Central Lancashire and Think Employment, has developed a digital competency self-assessment online module to help health and care staff to assess their own digital health competencies. And any NHS or care employee will be able to link to the UKDHC's assessment programme from home and carry out their own self-assessment online. This will be completely confidential, and they'll then be presented with a digitally validated PDF report about their assessed digital competence. And they can use this in any way they want. They may choose not to use it, or we hope that they'll take it to their employer and perhaps ask for help with improving their digital skills training. And UKDHC hopes to provide signposts to where further training can be provided and where it's available for free, because we believe that every frontline worker wants to become better at delivering their care, and this is one way that UKDHC can help them. So with me tonight, we've got a panel of experts, and I'm going to start with Professor Angus Wallace, a pioneer in health informatics and orthopaedic surgery, who continues to shape clinical informatics as the leader of UKDHC. He founded the Faculty of Health Informatics at the Royal College of Surgeons of Edinburgh, where he developed a master's programme in health informatics. And he also co-created the e-log for UK and Ireland surgical training. Angus, if we can start with you, can you tell us, why are you helping frontline workers become more digitally competent? What are the reasons for doing so?
I've been aware for some time, Alex, that although hospitals and social care have introduced digitization, and we have now not only people using their tablets or iPads and iPhones for recording information in a hospital and in the community, there has not been a sufficiently good emphasis on upgrading the digital skills of those who are on the front line. And when we created UK Digital Health and Care, what we wanted to do was to actually make the NHS and social care more efficient. We wanted to help. And we felt that one way of doing that is to upgrade the digital skills of those on the front line. So I did a little bit of my own research, and I contacted a number of quite senior people. Anthony May is the Chief Executive Officer of Nottingham University Hospitals, which is the hospital I used to work at. And I said to Anthony, if we were to create some training at the front line for people who are working in hospital, would that be beneficial? He said, fantastic, Angus, go ahead. You have our blessing, just do it. And he happened to be sitting with Nikki Turner, who was the digital lead of Sherwood Forest Hospitals. They've actually done quite a lot at Sherwood Forest Hospitals in upgrading their staff, but she also said, that's a good move, Angus. We support that. And then I have a good friend called Will Monaghan. Will started as a junior business manager in orthopaedics in Nottingham. I like to think I trained him, but actually maybe I didn't. But we worked together and developed an improvement in the way that we processed our orthopaedic patients in Nottingham. He is now the digital lead for the Leicester University Hospitals and Northampton General Hospital. I explained what we wanted to do. He said, fantastic, Angus, come back when you've got a programme and we'll discuss it. So here we have three very senior people who felt that what we were offering was something that was needed in the workplace. So we're going for it. And we are trying very hard to do this without charging the NHS or social care. We are trying to get it funded and sponsored through other routes. And I think we will succeed in doing that. And the first people to put up their hand were the University of Central Lancashire. And you're now going to hear what they have on offer and what is going live on the 3rd of February.
Thank you. I'll just give Jane a brief introduction. Jane, welcome. Jane is a member of the School of Health of the University of Central Lancashire, specialising in teaching health informatics, and she leads the MSc programme there. And with over 20 years in mental health service development and management, she transitioned to academia in 2019, now serving as Vice Chair of the Health Research Ethics Committee and promoting digital learning as a DigiLearn champion and Microsoft Innovative Education expert. So Jane, can you tell us what you're planning to do in your setting at the University of Central Lancashire and how this will work?
Yes, hello. Thank you. I'm really not an expert. Can I say that right now? One of the things that we've been able to do across UKLAN is we developed a digital assessment tool to help every staff member and every student work out where their skills were, how they needed to develop them, because everybody going out into the world now needs a certain level of digital skill. So talking to Angus and the rest of the team, we wanted to do something similar specifically for health and social care. So we took a look at the, sorry, I'm just going to move this across so I can actually see it. For those of you who don't know, I have a digital impairment, so I have to have big things on the screen in front of me. So what we did was we looked at the digital health and care capability framework and made sure that those sections of that aligned with our own. And in fact, they did very, very closely, which we suspected we would. So this digital assessment tool gives people 6 sections. So we have technical proficiency, we have creation, innovation and research, we have information, data and content, we have teaching, learning and self-development, we have communication, collaboration and participation, and just as importantly, digital identity, well-being, safety and security. So those are the 6 sectors. So each time somebody can go in, they can do all 6 in one go if they want to, or they can just do one sector. There is a list of questions. Once they've completed those, they will be able to download their report from that assessment. So it'll be their report, they can take it away, they can take it to their managers and say, I need help with this. But one of the things that we are putting into that report is resources that they might be able to go and use. So some of that will be the NHS Academy, some of that will be Microsoft, some of it might be from us. A lot of it, I hope, is going to be on the UKDHC website, because this is the next stage. What we're looking at developing are bite-sized chunks of learning that people can go and spend. You know, they might want to do a smaller part that only takes half an hour. It might be a podcast that they want to listen to. It might be a whole little module which I'm developing and will be available from the 1st of March, which is what is health informatics? What do people need to know about health informatics? Sort of health informatics for the non-health informatician, if you like. So that will be ready for the beginning of March. And these will all be not certificated, but there will be quizzes and there will be a certificate at the end, so they can actually put that into their portfolio and say, I've done this. And by doing that, hopefully we will spur them on to want to learn more. And they will perhaps be able to pass that on to other people as well. So that's where we're looking at doing that. We have other universities who are also interested in developing some materials to be on the UKDHC website. And that's going to be, you know, I think it's going to be, it could be a real game changer. And certainly the people that I know who are involved, we are all very keen to keep that moving forward. Now, one of the things I did want to talk about, because people get a little bit, what would be the word? A little bit uppity about digital and about distance learning, because all these things are distance learning. Now, UKLAN has done distance learning for 25 years with health informatics. It's always been a distance learning course. And it's one of those things that once you've tried it, and I'll give you some references, or I'll tell you some of the things that people have said. The thing about the distance learning is that all of our students work full-time in health and social care. Most people, if they're working in health and social care, do work full-time. They've also got families. They have to make the time. So what we've done is we've set up this whole module. You can do PG certificate, you can do a PG dip, you can do an MSc. So you can do as much or as little of it as you want to. But we've done it very successfully, and we've done that by being very, very clear at the outset exactly what's going to happen, exactly what the expectations are from both sides. We give them lots of feedback. There are formative and summative assignments, so we keep them on track throughout the whole process. So they might be studying in their own time, but they have very clear deadlines. They know exactly what it is that they have to be doing, and this is absolutely vital. So everything is online, everything is in one place. The materials include podcasts, webinars, YouTube videos, quizzes, learning checks. There are activities every week, things that they can do. So it's not just reading, it's not just learning, it's things that they can actually do each week. And every assignment is workplace based. So it works, they can take what they learn and use it immediately, and they can understand it in their context. And I think the other thing, and it's something that, you know, we are all talking about as a group when we're prepping these materials now for the UKDHC website, is that people like familiarity. They like the consistency of approach and material design because they know what they're doing with it. So it's really very important. The other thing that is vital importance is that support. And one of the things which I'm trying to figure out as to how I can put it in place is the support that people might need. And we give our students, because we work with them very, very closely, we know them very well, we give them a lot of support. You know, we do personal tutor meetings, we have regular catch-up meetings with them. That's not always going to be possible, obviously, with the more bite-sized chunks that we're doing with the UKDHC, but I still think it's important that there is an element of support available. So I'm working on that now to see how we can do that. But the whole thing about the distance learning is, I'm just going to give you two quotes from a couple of students. Alex has said, "Online delivery was crucial to me achieving my degree as I have a full-time career and family. The online learning allowed me to focus on learning at times that suited me with the added flexibility of support from module tutors." So you can see that, you know, what Alex is saying is, I could study when I liked, but I still had the support when I needed it. And then Wayne, "The course being delivered online gave me an opportunity I wouldn't have had otherwise, given that I work full-time and am not local. I could complete the studies in my own time and at my own convenience, whilst being able to apply my learning day to day in my career." So those are just, you know, a couple of things that students have said. So we know that we can make distance delivery work. And, you know, if people can get over that fear of, well, I'm just going to be sitting there listening, or I'm just going to be sitting there watching, once they realise that they're actually going to be doing and making use of that information in their own context, then that should be very successful indeed. So that's what we're working towards.
Thank you so much, Jane. That's fascinating to hear, you know, all those ingredients that are making your programme successful, to get that, the engagement, but also the flexibility for learners to make it useful and stimulating and engaging. And that's a really positive feedback. So thank you for sharing those. I'm going to move on to one of our other panel members now, but I will be taking questions for the group at the end. So hang on to any questions at the moment. I'm going to introduce John now, John Sutton, who's a seasoned recruitment manager with close to 10 years experience in both the UK and European Union. And he's currently based in the UK as the Employer Engagement Manager for Think Employment, where he develops digital marketing and data analytics skill boot camps in South Yorkshire. John also supports local businesses in upskilling their team members, enhancing retention and fostering development. So John, can you tell us about your experiences and what's worked for you?
Yeah, no problem. We are looking, or what we currently offer is a certificate in data analytics, which is supported and funded by the UK government. The course is designed to provide a deep understanding for of various data analytics tools and techniques that are crucial in today's data-driven business. That also lends itself very well in terms of the NHS, because pretty much every single role within the NHS now is also driven by data. So that's one of the reasons why we look to promote this course in such a way so that it's leveling or putting a level case into every single area within the NHS. Now, the course duration, it's normally 12. It can run up to 16 weeks. In terms of the upskilling side of things, or for the course leveling side of things, it's an on-the-job course, which is done online with a personal tutor. The schedule will usually be between Monday to Friday and between the hours of 9:30 and 3 p.m. And each session is 2.5 hours in duration. So you're looking at round about 7.5 to 10 hours of commitment per week in order to fulfill the course. The entry requirements are open to anybody aged 19 or over. That means as long as they're born after the 31st of August 2005. They must live in an area of the UK that is not a devolved authority, but we can help and we can support that if that is the case. They have to have the right to work in the UK and meet residency requirements, which again we will help check in terms of what their status would be. So the courses, the modules within the course, they'll be studying data fundamentals. So the learner will understand where common sources of data can be found, the purpose and the function of data formats and their importance for analysis. And this will also understand the purpose and the function of data architecture and the visualization for a specific business requirement. They will also touch on to Google Sheets, so the learner will understand the visualization tools, communication methods, and the characteristics that inform the appropriate method. The learner will be able to apply visualization techniques and communicate data and results to the appropriate audience for a specific business requirement. Power BI, so the learners will use the powerful business analytics tool developed by Microsoft, as we all know, for a variety of purposes, from data visualization and data integration to understand how to collaborate and share reports and dashboards with others. Data management and SQL, so learners will gain a knowledge and understanding of SQL for data analysis, and with its various functions and abilities, learners will be able to retrieve, manipulate, transform, and filter information ready to query data for a purpose of a given task. Microsoft Excel obviously plays an important part in data collection anyway, so the learner will be able to collect, format, blend, link, save data sets from multiple sources. They'll be able to prepare data for analysis as well as that, as test and assess confidence in the data and its integrity for a specific business requirement. And also the last one is Python. So they will learn Python's programming language to clean and manipulate data and identify the data trends and patterns. The idea for this course is, like I've said, to formulate a team or formulate a department so that they are all working with the same tools and they all have the same level of understanding with those tools. That's basically what we currently offer within our region.
Thanks, John. That's really interesting. And what sort of feedback have you had to date? Is there any feedback you can share in broad terms?
Yeah, we've also in one of the areas in Doncaster, we've also noticed that the course is also lending itself quite well to people returning to work from long-term sickness. So this tool is also there as it allows the employer or the organization to provide an accessible tool to people on the on a long-term sickness program, so that they can either go into the workplace on a just as a 10 to 15 hour per week section, or they can still work on remotely because it's all assessed. So there's measured progression, and it's all, and the modules can also be integrated. They can be integrated in the way that they're set out now, or the employer can also add in specifics which will be relevant to the team or relevant to the environment or the industry where they're working.
So there's quite a lot of flexibility. There's flexibility.
Oh, for sure. Yeah. Mm-hmm.
Great. Thank you, John. And moving on to David. So David is David Wright, a director at UK Digital Health and Care. David, you have experience in social care. What do you feel are the needs for digital health training in social care? Any thoughts, David?
You say I've had expert in social care
Experience.
experience, yeah, I'm going to actually take a different tact, if I may, Alex. I want all of us to take a really big picture view of the challenge that we're facing. Okay, population of the UK, 68 million. You got 1.3 million staff working in the NHS. You got 1.5 million working somewhere in adult social care in some capacity. 3/4 of those working in social care actually work directly with patients. They're all at different skill levels. If you think at those working in an ICU unit or a maternity unit, the skills that they're using with digital, and then you go right down to those that are dealing in a hospice, those that are dealing with social care environment, aged care facilities, it's all different levels. And the whole premise, the underlying premise of UKDHC is to raise the whole level right across the board. Now, when we break down the health system, if you think about, you've got preventive care, you've got primary care, you've got secondary and tertiary. And the big problems occur within the health system is between primary and tertiary, the entry, discharge, and then the discharge into whether it's hospices or aged care facilities and so on. That integration, it needs to improve, and the use of digital skills in those areas will improve over time, as long as they're integrated. And there are so many silos. Now, I've spent my whole career in healthcare, not in the UK, 40 years in Australia. And I was thinking just now how many health ministers I've dealt with on the same issues. I've dealt with 5 in Australia, 1 who became Prime Minister. And I've had the same arguments with, not arguments, but debates on taking a whole of system approach with regards trying to improve the integration of healthcare. Some have picked it up and run with it. And when I'm now researching the work that's going on in the NHS and the talk that I've been reading about building all these hospitals, and Wes Streeting talking about the different sectors we need to address, I believe that the work of UKDHC in raising the level of skills is going to be the underlying foundation for improvement. Medicine is premised, the whole medicine education is premised on see one, do one, teach one. You think of Angus as an orthopedic surgeon. It's see one, do one, teach one. I'm an ex-teacher. I taught in London for 5 years before going to Australia. And that's what it was all about. See one, do one, teach one. And whether it's dealing with an iPhone, whether it's dealing with Epic or Cerner in a hospital environment or nerve center, all these require skills. And 50% of all projects in IT fall down and fail because of training and education. Now, I lecture in change management as well, how to get change management and behavioral change. And it all comes down to not just see one, do one, teach one, but it's actually the underlying stepping stones of learning and engagement. I'm not an IT person. I don't profess to be an IT person. I'm a user. I'm a user of IT. And 99% of people in healthcare settings, they are users. They're not programmers. They're not interested in the acronyms. They're interested in how the IT will make their job easier, more efficient, save their time. And sometimes the people above think about how can it save money. Now, I've been thinking about this over the last couple of days because of dealing with organizations that are very innovative who are trying to do entry into the NHS. They've got great ideas, but on the other side, the NHS is very risk averse. Why? Because they're dealing with patients, they're dealing with healthcare. They're incredibly risk averse. So the number of pilots going on around the country in different ICBs and trusts and so on, it's amazing. And some of these pick up and some of them are run with. but there's a lot of cross-pollination of ideas that needs to occur. And I think UKDHC has the opportunity of doing that. What works, what doesn't work, what can be improved in the future, and the learnings accordingly. But there are so many terrific ideas that come not from the IT nerds that are out there, they come from the frontline workers. And you only have to ask them a question. If I can give you a wand to improve your job, what will it be? Well, obviously they'll talk about other issues. They'll talk about pay or stress or whatever. But we're talking about IT, which hopefully will reduce the stress. But on many occasions, it increases the stress. You've only got to go into some of the if you go into a hospital and you see the amount of time that doctors and nurses spend looking at screens and not looking at patients. You know, let's get back to this patient care and making IT work for them, not them work for the IT.
Thank you, David. No, for those insights. You know, it's all about building confidence for the workforce, creating opportunities for learning that are accessible and flexible, and UK Digital Health and Care can hopefully help achieve this. Would anyone else like to add any comments or reflections? Angus, did you want to add anything there?
I do want to ask
Great.
Johnny Sutton a question. Johnny, I'm keen to know how easy you have found it to carry out distance teaching with the workforce that you've been involved with, because we are talking within health and social care of people who are supposed to be well educated, but they struggle to be taught from a distance. How have you managed to achieve it, Johnny, in the workforce that is a different workforce? And before you answer that, I was fascinated by a project done by West Notts College, which is a further education college, who were asked by Nottinghamshire County Council to train their refuse collectors in using iPads. And the reason was that they wanted to make them more efficient for their what we used to call dustbin rounds. And they communicate with home base and they get a route and they follow that route. But of course, that route can be modified if you can get messages to them quickly. So they managed to achieve that, but it was quite hard work. How has it been for you, Johnny, with the work that you have done with Think Employment? Because that must have been a bit of a hurdle, getting people into the distance learning.
It can be. A lot of the time you've got organisations which are already bought into it, so they're already looking to. They have teams which are at different standards at different levels, and the main reason what they try to they bring us in is to level the playing field, so that for example, we also do digital marketing as well as data analytics, and we have a company that we work with called Sparrow Solutions, who provide team members out to other organizations to help them support with their digital marketing. That can be very individual in terms of what somebody's perception of how to promote something is. So the organization would like their team as such to all be at the same level in terms of what that digital marketing is for Sparrow Solutions, so that they do a uniform sort of promotion, a uniform sort of sell, which is also easier for monitoring things like performance, staff performance, key performance indicators, that sort of thing. So, but I'm talking predominantly regards to the private sector. So that kind of leans a little bit into what was mentioned earlier in terms of there's a financial gain, and what was the quote? No one gets sacked for losing money in the NHS. Now, obviously, we're a business, we're an organisation, so we sell our services to predominantly a private sector at this moment in time. So if somebody will get sacked because they will lose money, so there's a different drive and a different tax and a different arena, but that the course that's offered, it lends itself to both sides, the public sector and the private sector. So in that sense, I see this would easily fit into the NHS sort of format, for want of a better word. But it's, for us at the moment, I can only talk about experiences from the private sector.
Yeah,
Thank you.
interesting.
Really interesting. I had a question for Jane. And your program, you've obviously thought of all those ingredients we talked about earlier, but have you had any challenges, engagement issues, people who've struggled through the distance learning?
Yes, and you always get that. And one of the things that we do is to work very, very closely with the student right at the beginning. So, you know, they have a personal tutor, and we are available. Yeah, we're not available 24 hours a day, 7 days a week, because that wouldn't be possible. But we make it our aim to respond as quickly as we possibly can within working hours. So, you know, obviously we all have other teaching commitments, and so it's not always possible to respond straight away. But, you know, we keep an eye on it. So if a student misses an assignment due date, then we can get hold of them straight away and go, is everything all right? Are you okay? We have options for them. You know, if a student is really, really struggling, step back from it, take an interruption to study, come back to it in 3 months' time or whatever, because all of our modules run twice a year. So you can step back, we can give you an extension on the assignment. You know, there are lots of things that we can do. Send us a draft and we'll give you feedback.
Brilliant.
You know, it really is a case of, I always think that most of my job is about giving the student confidence that they really can do it.
Thank you, Jane. I think that's so important.
You know, once we get, I had a lovely, not last year, the year before, somebody who graduated, and she put in her the acknowledgement section of her dissertation, and a special thanks to Jane Fitzgerald, who dragged me kicking and screaming through this MSc. And, you know, this is a girl, I didn't meet her properly until her graduation. But, you know, we've got to know each other very, very well. I mean, I've met her before she started, because I literally speak to everybody through Teams before their application is accepted, because people need to know what it is that they're letting themselves in for. And it's not easy. It's not an easy thing to do. Where I win, I think, is that I did it. I did that, the MSc in Health Informatics at UKLAN, distance learning, whilst I was working full-time somewhere else. So I really do understand what it's like. And I'm lucky in the fact that the university have gone, yeah, we understand all the problems, do what you need to do. It's great.
Thanks,
So
Jane. It's great to hear.
So it's about giving them that confidence that they really can do it.
Any questions from anyone else? Angus?
Can I point a direct question at Euphoma? Because she is working within the health service at the moment. She has a real interest in training and supporting. Her initial plan was to move into digital gaming. And she's a very, very skilled digital person. But now she's involved with the NHS workforce. Euphoma, how do you think we can make a difference? Are you able to chat to us?
I'm actually able to talk. Thank you for asking me. Hello, everybody on the call. So to answer your question, I think what has worked for me on the projects is actually having that conversation with the people that it affects the most. And you may think, okay, it's the patients, but it's actually people giving that service to the patient. So it can be a phone call conversation or a face-to-face conversation, and actually asking them to take you through their process. How is your typical day like? What I found is when you see how their brain works on a typical day of how they deliver that service, you get to see the pain points. So you will hear stories like, oh, I have to fill 3 forms to get this patient discharged, or I have to tell this person, tell that person, have this signed off. So when you start seeing the pain points, it's easier for you to make their delivering patient care easier. So it's just having that conversation with them and helping yourself see their process to deliver care.
Yeah. Yeah, that's very helpful, because I think you have to go with the person, and one of the concerns is that they can become scared. they think that it's too difficult, or they think that you're going too fast. And you have to ensure that the speed that you progress them is tempered according to what they can cope with. Have you experienced of that, Euphoma?
What I've experienced, yes, is something similar to that. I think more is their technology fatigue, because I think in recent times a lot of softwares and solutions have been thrown at them, and so they're like, oh, this is another one. So it's explaining to them how it's going to make their life easier. So not selling them the software to say, oh, this is how you're going to get things done. It's more coming from the selling point of, this is going to remove 20 hours of your work time. This is going to remove 20 minutes of your admin time. So selling them the relief to their pain points actually makes them buying quicker.
And Euphoma, can you give us an example of that? I know that I met some nurses who, when Microsoft 365 was brought in, there was no guidance and training to staff. It was suddenly imposed on them in a hospital. And some of the features that they previously had access to disappeared. But do you have any specific examples that you can tell us about?
Okay, yes, I do. So I haven't had the privilege of working with a software that was brought by me from the beginning. I always came in the middle. But there's a particular example of a mental health, software that was built before I came in, and they were having issues with the wordings and the terminologies. It kept changing. Maybe someone would come today and say, oh no, I don't want it to look like that. So it had to take me and a few other people to say, okay, what exactly do you want? And it was something as simple as they said they hold the iPad on their left hand. So it's easier for them to have a particular button on the right. So something as simple as that, I was able to pick that up and I said, okay, can we move this tab to the right? Because they're holding it on their left. They're trying to do their observation. So make it easier for them and put it, on their right. And the feedback was like, oh my God, I didn't know that this was possible. So just listening to that pain point and solving it for them.
Thank you.
Thank you. Elias, question from you.
Yes, thank you very much. I very much enjoyed all the discussions. And I must say, except to surprise my professor, the other reason was to learn about integration of care between the primary and the tertiary. And at least here in Greece, there is a great gap. And I'm working on that with the health authority here. So I wanted to hear some solutions we have already provided. And if it is a possibility to cooperate with you. Also, I have been involved with the Fragility Fraction Network, the global, with David Marsh, for 10 to 12 years now. And I'm really interested from this point of view on nursing education. So thank you very much. I think I learned a lot that you are facing almost same problems that we are facing here. And I'm looking forward to follow you and see if there are opportunities for us to work together. Thank you very much.
Thanks, Elias, for those contributions. And I think that sort of phrase, that every problem creates an opportunity. There are opportunities here with these digital challenges. Peter, I understand you're unable to speak, but thank you for your comment, which I'll share from you, that from Peter, that the thing we see as most valuable is providing materials in different formats to handle learning types. And he also agrees with the same concept that David talked about of see the theory, go and do it, then teach it, see one, do one, teach one, keeping it bite-sized so people need get what they need when they need it and can use it promptly and quickly. So yeah, thanks Peter for sharing that to reinforce.
Alex, if I can give you a little bit of background, Pete is digital lead for My Dentist. And he covers providing digital support for My Dentist, both My Dentist contracted to the NHS and My Dentist, which is in the private sector. So he has to deal with that side of things. And when we chatted previously, he has a lot of frustration about the lack of integration between dentistry and the NHS.
Thanks, Angus. No, that's really helpful to give a little bit of background, but thank you, Peter. Any other questions from anyone else or comments? I can't see any hands up, but I think we've covered a lot of ground there. And thank you to our panel speakers. Really interesting to hear your perspectives. And thank you for sharing those with us, your experiences, what's worked, challenges, but the opportunities that are out there. And I think, upskilling all of us is so important, but in a safe way to make it user friendly. So thank you all for that. And I'm going to hand over to Angus now to bring the evening to a close. Thank you, everyone.
Excellent. Thank you very much, Alex, for chairing this. I'm very grateful to you. We've been running these weekly webinars for a long time. The programme for February has been delayed a little bit because we've been we're in the process of appointing both directors and executive committee members for the UK Digital Health and Care. And we've had a lot of applicants, and David Wright and I have been working very hard. But in February, we plan to have one session, one webinar on the NHS app, the good, the bad, and the ugly. One on hearing aids. And we're going to do that because hearing aids are very sophisticated computers. And you would not believe what can be done nowadays with hearing aids. So we're going to give you a bit of education on digital hearing aids and what they do. And then DJ Hamlin Brown is going to talk about patient safety at the end of February. So the programme will come out on Friday. We will distribute it, and you're all very welcome. This is a series of free webinars. So I'll hand back to Alex. Thank you very much indeed.
Thank you, Angus. Well, we look forward to seeing everyone at a future webinar in February now. We're through January nearly. But thank you all to our speakers and for a really nice evening. And enjoy the rest of your evening, everyone. Good evening.